A Machesney Park woman says an allergic reaction to medicine set off a rare disorder that's left her with blurry vision for her future.
WYFR's Nathaniel Langley finds how she hopes her ordeal raises awareness for Stevens-Johnson syndrome.
Sydney Jake, the Mayo Clinic finds Stevens-Johnson syndrome, or SJS, severe and unpredictable. Andrea Coogan's battle with the disorder lasted less than a month, but inflicted permanent damage without a cure. And just a caution, some pictures we show are graphic.
I live off these. I use 25 to 35 vials a day.
Andrea Coogan seeks rare relief from her eye drops.
These are my blood serum tears made out of my own blood.
A severe reaction to medication left the Machesney Park woman legally blind.
This is it. The damage is done. There's no coming back from it.
Coogan took Lamotrigine for epilepsy in 2021. After 2 weeks on the meds, she visited 5 doctors with concerns.
I have this sheet of paper of severe side effects. I'm having every side effect.
She claims hours in the emergency room provided no answers.
Would I be this hurt if somebody would have just listened to me about my own body?
The 45-year-old says blisters appeared on her throat and body, eventually compelling her to use a feeding tube. Doctors diagnosed Coogan with Stevens-Johnson syndrome and toxic epidermal necrolysis.
I'm septic. I have all of these burn blisters all over my body. My eyes I couldn't see.
The National Institute of Health reports SJS-10 affects about 2 million people globally per year.
It has completely ruined my quality of life.
Coogan estimates she pays about $1,000 per month out of pocket for treatments.
The eye community is so ignored with treatments. A lot of treatments should be covered under insurance.
The SJS-10 survivor focuses on awareness, pleading for healthcare providers to offer more support.
I'm doing what I can do to manage on a daily basis, and this will be the rest of my life.
Coogan says her trust has been shaken. She stays with the medication she knows works and takes a more holistic approach elsewhere. She makes ends meet through disability, but worries changes to her monthly amount will shrink options for treating her eyes.
Researchers find medications cause more than 80% of SJS cases. The Stevens-Johnson Syndrome Foundation says most meds responsible are anticonvulsants like the drug Coogan took.